the aesthetic podcast from Local Women magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to episode 4 of the Local Women podcast for our aesthetic podcast. I'm Emma Heaney from BTL Aesthetics, and today I'm delighted to be joined by Tanya Khan from Tanya Khan Aesthetics and also by Jamison from AlterEgo Aesthetics and BTL Aesthetics as well. Hello ladies.
Hi Emma.
Hi Emma.
So today we're actually going to talk about lower face rejuvenation. We touched on it briefly in the last podcast and I got so many messages from it. So my two amazing guests today, we're going to explore the lower face rejuvenation. Yeah. So to start off with, I suppose it's the myths versus the reality of that cinched jawline. Ladies, what's your experience with jawline filler? What way do you rejuvenate the lower face? I'll throw that to you, Tanya.
I love jawline filler on the appropriate patient. Unfortunately, there's just not too many. Social media now has made it very difficult for us to perform a jawline filler treatment for women and maintain realistic expectations.
I'd agree.
Absolutely.
So what we're seeing on social media is a lot of trickery with lighting and angles. So on my own social media, I actually did a before and after picture of my own jawline. And the pictures were taken literally about 10 seconds apart. So the first one had my chin down, exaggerating a little bit of the wobble and no lighting. And the second one, my chin was up, slightly moved away with good lighting. And I wrote on the caption in big capitals, "No treatment performed here." And actually, the comments underneath were, "Wow, this is amazing. What treatment is this?"
Yeah.
So true.
The picture, they just seen the picture and they didn't even read the writing, the caption, and just assumed that I'd had, a jawline filler treatment.
Yeah.
It's that easy to fill.
I think that's a really valid point, because even if you're looking at before and after photographs, look where the eye is focused. Because if I look down, you'll see a massive double chin. If I look up and reach, it's perfect. Like, you don't actually need any treatment at all. So it's a really valid point. And I actually saw that post. It was excellent. Tara, you're fantastic at doing fillers, and I'm not a massive fan of jawline filler. Mm-hmm. Again, like Tanya said, it can give an unrealistic expectation, and the volume that you'd have to put in to get that chiseled side profile, it's extreme, which looks beautiful from the side profile, but when you look straight on, then the face looks too wide.
Absolutely, too masculine.
That's it. You're
especially
squaring
in your
off.
feminine patients. What I find is with a lot of patients, it depends on what their concerns are. For some people, if you have, say, a recessed chin, they will come to me looking for jawline filler. However, once we educate them on what would actually elongate the jawline, would be to extend the chin and bring it into balance with the rest of the face. That's the kind of education the patients need. I would say we do very little jawline filler unless it's a patient who maybe has some jowling or jolly wobbler formation, as I was saying about earlier. Because sometimes you do need to put a wee bit just at the gonal angle, as well as a wee bit in the chin, just to kind of elongate it. But it is in no way a full-on snatched jawline. It's an improvement.
Yeah. And
just a wee bit of support for the aging face.
That's correct. I would do exactly the same technique, just slightly here, because for our listeners and our viewers, what she means is here and here.
Just at the
and
angle
to create
of the jaw,
It's a bit of blending, so it doesn't take away the jowling effect.
No.
What it does is it kind of masks it a little bit, because we're losing volume behind and in front. So when you place it there and there, like you have talked about, it masks it, but it doesn't actually remove the jowls.
That's right. It's a bit of smoke and mirrors.
Absolutely.
Yeah. I'm very good at
It
smoke and mirrors.
Contour queens.
That's it. And what about toxin in the lower face, ladies? Will we talk about it when we see it all over TikTok?
Yeah.
Some of it's a little bit factually incorrect and some of it's really good. So let's talk lower face toxin.
So I personally like lower face toxin on myself. I suppose it really depends on, again, it's always patient specific. So if someone has a lot of activity, as we get older, the lower half of the face muscles tend to become a bit stronger than they need to be. And if you place small amounts, it can just relax that pull down effect. So if you're thinking about the corners of the mouth, the muscles that kind of pull down that way, and the chin can be hyperactive, it can kind of pull up this way. You can't see it on me because I may have a sunlight effect. And then what I don't have at the moment would be then down onto the neck. As you can see, we get these kind of bands, a bit of the Deirdre Barlow look.
Yeah.
And so personally for me, it works really well because I would be a person who plays, with the lower half of my face. I would clench my teeth. So whenever I have small amounts put into those areas, it just relaxes everything, and it definitely makes me feel like I have a more youthful appearance. However, if you over-treat these areas, you can run into a lot of really not nice complications, where if the toxin was to spread, if you put too much in, we can have it affecting muscles that will leave you with a very strange appearance, or over weakening, where people feel like they can't drink through straws or mugs or even pronounce certain words properly. So yeah, it's, again, in the experienced hands, can be a lovely treatment if with the right patient.
Yeah, and I think that's a really valid point. Lower face toxin is for the advanced aesthetic nurse or doctor or dentist. If somebody's just starting out with aesthetics, I don't think it's somewhere you start injecting straight away.
It's not that we're putting, the lack of experience down in any way.
Not
what
at all.
It would do is actually potentially affect your confidence.
Mm-hmm. Yep, I would agree. And what complications have you actually seen, Tanya, with lower face? I know I've seen a few crooked smiles, desperate Dan chins. What about yourself?
Yeah, definitely. The one it tends to be the most common in practice is when we're treating these muscles that go from the corner of the mouth down, pull down this way. We call them the DAOs. So if that is injected too much too quickly, or not anatomically placed correctly, it can spread into another mouth muscle over here that actually affects lip movement, and that's the one that leaves crooked smiles. And it really does affect patients, it affects their confidence. They have these treatments to feel better about themselves, and they spend, a fair bit of money. So it's not ideal to leave your patients looking worse than what they did.
Absolutely. But what I have to say is I have done that on a patient myself. I have done it. I
Me
thought
too.
I had placed in the perfect thing, but I also knew how to deal with that. Do you know what I mean? That kind of way, I brought her into the clinic, we assessed it, and I was able to then treat her opposite DLI to improve her crooked smile. And, it did help. So it is important to say that these can happen to any practitioner, but it's knowing how to deal with it and how to minimise.
And also
the
how to
effects of these
speak
happening.
with your patient as well.
Absolutely.
Because if you're feeling really awful, because you don't feel great about it, and then you project that onto your patient, that's not really helping them. So, you need to have the confidence in having a conversation with your patient and, telling them this is a known side effect, the complication, and how best to deal with it moving forward. But actually something new I came across was if you are to spread the affected area, the affected area you didn't want to take it with saline, with Torvac actually, not saline. There's a study to say that it can help the toxin to be resorbed and to help get rid of the negative side effect.
You shared that on a recent WhatsApp group. It was really interesting.
That's where I seen it. I knew I'd seen it somewhere. It was you who had seen it then.
Yeah, it was Tanya.
I thought I'd read it somewhere.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
So when we talk about lower face toxin, we can do the gummy smile, we can do the downturn of the mouth. So like once you hit 40, you sort of look sad, which is not the case. You can also do the masseters, which is really, really good for teeth grinding. But I know some people would use it for facial slimming. I'm a little cautious with that because if you've any jowl in here, or what do you call them?
Jolly wobblers.
Jolly wobblers. So if you've any jowl in here, that you're not a patient for that treatment because that can actually increase the jowl effect. Yeah. But when done properly for teeth grinding and things like that, it's a fantastic treatment. But I think don't see something online and think, oh, I want that. That's all part of your consultation process as well. Other places, where else would you do lower toxin? I know I like it along the jawline.
I love it.
I love it along there.
Yeah.
And again, so your platysmal bands,
yeah.
Your Deirdre Barlow, I like that. But as you said earlier off camera, really to hear, because do you want to explain that? Because I thought that was really interesting.
So there was a recent paper that basically in the upper forehead we have what's called a line of convergence. So when patients are coming in and we're telling them that if we take away all their lines and wrinkles directly above the brows, not all patients have them, but many do, that we can actually drop their brows and drop their eyelids, because part of the muscle's pulling up and part of the muscle's pulling down. So it's the same with the neck. So if we were a long time before this paper, basically it was common practice, if you were treating what we call the platysmal bands, you were going the whole way down to the décolleté. Whereas now this paper has shown that it's the same effect here in terms of pulling up and pulling down. And if we only treat to the first half from the jawline down, you'll get a better effect, because if we have any kind of sag in the décolleté area, that if you over treat down here with toxin, you can actually make that more wrinkly and more saggy.
And we do not want wrinkles and sagging.
Don't want
No,
wrinkles
No,
and sagging.
definitely not. When we talk about wrinkles and sagging, what is your go-to treatment? In your clinic, a lady comes in and says, I'm too saggy. What are you going to do?
Get a facelift. neck lift. I'm really joking. Well, I mean, I definitely don't not talk about surgery, because, you know, that is
I agree.
something that, you know, something that many people are open to hearing about. But in terms of they're not there yet and they want to spend their money on having treatments, it's really about improving the quality of the skin first.
Yeah.
Okay. So, you know, you're looking at things like your skin boosters, your Profilo. So that is like it's basically like filler for the skin. Mm-hmm. Okay. And a little bit of toxin, but again, on assessment, if they don't have a strong pull, it's a lot of money wasted and they're not going to see much of a result. And also prescription only skincare. So, you know, taking it from the face down to the neck as well.
Yeah.
And then obviously your sun cream. Mm-hmm. So improving the quality of your skin is what I would say first. And then you could maybe move on to things like machines. I don't offer them in my clinic personally, but I would recommend them.
Mm-hmm. Yeah. I would the same. I mean, I'm not opposed to surgery and I would recommend surgery, but if they aren't at that point, I think it's really, really valid to sort of say, well, these are the options that you have, you know, but nothing's going to give you the result that surgery gives you. Mm-hmm. But I think you made a really, really important point there, skincare. You know, absolutely. And when I do my skincare routine at night, it's my face starts here and ends here, and the back of the hands get a little touch as well. Yeah. You know, because this will give a lady of a certain age, let's not say my age out loud, but this will give a lady of a certain age away. So there's no good, like I always say, it's no good if the living room looks great, the hall needs decorated as well. So that's where my face starts, you know. So I think that's really important. And you talked about Profilo in the neck. As you know, I'm a massive fan of Profilo and I do a lot of it. It's a collagen stimulant. That's what I love about it. And they recently brought out the Profilo structure as well, which does, it's like the sagger or the sinker face. So I'm a sagger, okay?
Not at all.
Oh, well.
I feel like I'm both, a wee bit of both.
Well, do you know,
my gosh.
I had this conversation with somebody, you can actually fall into both remits. So maybe we'll do that someday in Elite.
Yeah, we practice session.
I'm doing some sort of trials on that product at the moment, so I'll show me before and after.
Models?
No problem at all.
We're all there.
But yeah, I do a lot of injectables in the neck. Profile will probably be my go-to, and then skin boosters. What about yourself, Tara?
Yeah, so with regards to wrinkles and improving the skin, exactly what Tanya said, it's all about improving the integrity of the skin, and it's a multimodality approach. So a lot of people overlook skincare at home and they're happily spend thousands of pounds on injectables, but you tell them to go on cream, they're like, nope, not spending that on a cream. So yeah, it starts at home. We would also use the likes of PCLAs, polynucleotides, anything that's going to promote and stimulate collagen growth. They're kind of my go-tos for improving skin tone and integrity, and then a wee bit of a skin booster or filler, because sometimes you have a bit of bone reabsorption and stuff as well that's causing like deeper static lines, the likes of nasolabial folds or marionette lines. So you do need a wee bit of filler in there just to kind of help put everything back to where it used to be and kind of fill the space that's been made as we age.
Mm-hmm.
I guess the only thing that I have about the collagen stimulating products is that we have many women, well, most of the women who are needing these products are perimenopausal or menopausal.
Yeah.
And we know that our estrogen plummets. And for those who are not topping up their estrogen levels, you know, they might not get as good a result. So I think it's really important that we maintain realistic expectations with patients, because when we're using collagen stimulating products, we're reliant on their body doing the work, you know, as reacting to the stimulation from these treatments. But it's important that realistic expectations
Absolutely
is of paramount importance, because otherwise our patients are left very disappointed.
And disheartened.
Yeah.
I mean, I'm very, very direct, perhaps, in saying, you know, this one treatment, 2 treatments, but maybe you'll need 3. You know, when I'm doing like the boosters of Profilo as well, I think I probably undersell my treatments and then try to over deliver,
so they're happy
with the results.
for your patients, you know?
And I think, I suppose, I would say this is the result I can get for a 35-year-old. But if you're sitting at 65, we have to sort of rethink
That's
this.
so important.
And I think as well, I'm only doing like 30-minute appointment. It's what they're doing at home as well. Their diet, lifestyle, that has a massive impact. But you can't take away the importance of SPF. You know, we talk about all our different skin cares, but SPF 50 every day. I mean, I have a swarthy skin tone, but I still wear SPF every day. That's one of your best anti-agings, you know.
Oh, I'm there. I'm definitely there. I'm 44 and I was on holiday there a couple of weeks ago in Tenerife and I covered my body. Mm-hmm. Like normally I definitely would have been covering my face for a long time, but I definitely would have put, you know, maybe a high factor, but let the body in the sun. No. I know. That's where I'm at.
Okay, well that's a good
growth.
Yeah.
It's growth.
Yeah.
Well, I just actually put a post up on our social media this morning too about SPF 50. It was a really good podcast and it was all SPF 50. So I've shared that on our social media. So you can do the £200-300 treatments, but don't neglect your SPF.
You have to have a responsibility. Do you know what I mean? That kind of way. A lot of people think that the results end with us, you know, and what they don't understand is you have to be doing things at home. Your aftercare is so important. Even prepping yourself before a procedure is also really important. So, guys, you need to take responsibility.
And I know we've talked a lot about injectables, and there is other treatments out there. We've talked about surgery, and there's really some fantastic devices as well. I know the devices, for me, it's a high investment for your patient, so you want to deliver results. But I think the most important thing about devices is that anything that you use, you need to maintain. You can't just do like a course of 6 treatments and that's you forever. Yep. You know, there is a level of maintenance there. So I think that's so important. It is a big investment.
I think that's the same for toxin treatments. No one ever starts getting toxin treatments and then 6 treatments later think it's going to last them forever. So why would it be the same with any other treatments?
That's a really good point. Yeah. What devices do you like? Or do you know of any new devices that are out at the moment for skin rejuvenation or facial aesthetics?
So obviously working with yourself, Emma, you have a lot of devices and I have seen some amazing results with them. The likes of the M-Face, I have seen some really great facial tightening with some of the ladies up in clinic. And do you know what? I'm a stickler for microneedling, which isn't as much of a device because it's a smaller, you know, kind of pen. But with consistent treatments and a good treatment plan with implementing what your skin actually needs, there's some beautiful results.
Yeah, well, like, you know, it has the potential to improve your collagen by 400%. Yeah. You know, I'm a massive fan of microneedling, as we know.
It's so underutilised though too, isn't it?
In the right hands, the right device. And the right glides, you can get phenomenal results. Yeah. And I would agree, M-Face is, it's been a game changer in Elite, I have to say, especially for the cheek and submental area. Yeah, it's lovely for the forehead as well. But I think for a lot of my patients, they've got toxin there. So, but yeah, for the cheeks and the submental, we've got some really lovely results.
Beautiful. Yeah.
And I'm really excited. They've just released the eye for the submental, for the eye area.
Yes.
And so we're launching that very shortly. Of course, if you can't get on the machine, it's because I'm on it. But I'm excited about that. Also as well, radio frequency is fantastic for skin tightening, collagenesis, and that's what you want. But again, it takes commitment.
It does.
You know, that's where I would be with the devices.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
So I've done a few quick fire because I actually mentioned on my social media who was coming on. So I said, anything you want me to ask? So they threw some questions at me.
Oh dear.
So I'll be gentle. I definitely will. So
better be ready for honesty.
If that you say quick fire, it'll probably take me 10 minutes to think of what to say.
So we'll do an easy one to start with. Lip filler or jaw filler? I know your answer.
Lip filler.
Every time, Tanya. And yourself.
Yep, lip filler.
Yeah, me too. Definitely. One treatment that you would never have done on yourself?
Sculptra.
Okay, why would that be?
So that's not to put Sculptra down.
No,
as a
it's a
treatment.
great
It is
product.
a very impressive treatment. So it's another collagen stimulating treatment, and the results from it are exceptional. However, the kind of collagen that it is producing in the face is type 3. Am I correct in saying
Well,
that?
you're a bit of a collagen. You do a lot of sculpture.
Yes, we do a lot of
Type
sculpture.
3?
Yeah.
So from my knowledge, and I've battled with this because I'm definitely at the age where I would benefit from Sculptra, and I have
Me too.
put a lot of thought into it, and I've decided against it for me, because if you're going to have a facelift at some point in your life, which I 100% am going to have, it can make things just a little bit more difficult for the surgeon.
Right.
And so for me, I'm not going to wait 10 years for a facelift. I'm 44. I'm probably going to get it within the next 5 years. I'm going to enjoy it in my 50s as opposed to waiting until it's worse. So I think I'm good to hold off for another 5 years, not having the Sculptra, in the hope that it doesn't potentially make things a little bit more difficult for having a facelift.
Okay, that's a really valid point.
But not everyone's going to do that, or is even sure that they're going to do that, or even
wants to go down the surgery angle.
No,
So
definitely
no,
not. So that's not to say that Sculptra is not a great treatment, but I've just decided I will never have it.
because you're going for your
I like
facelift.
surgery.
Ooh, love it.
And what about you, Tara? What?
If I'm honest with you, there's not much that I wouldn't have. That's being honest with you.
Like
but
it.
the likes of those fads that are coming in, the likes of lemon bottle, all these things that haven't been researched and are just brought onto the market, we know nothing about them, and people are expecting them to work. For me, having a treatment done, there needs to be a bit of a basis, a bit of information about it, a bit of research into it. So, yeah, just your kind of fad treatments, lemon
Yeah.
bottle and stuff like that.
I would agree. Yeah. Which one will we do next? Okay. What's your go-to in skincare? What product can you not live without in your skincare, Tara?
Mine's Me Active, which is I use a retinol. Tretinoin's a bit too harsh for me. So yeah, I think the thing you should invest most in is your active. A good cleanser and a good moisturiser are kind of standard. You know, they're not too hard to find, but a good active.
A good active.
Yeah.
I'm tretinoin.
I know you're a tretinoin
My
queen.
I
tretinoin
wish I could.
everywhere.
I wish I could. It's just so harsh. I shed like a snake whenever I have it.
Well, we did a really good product where you did
So
a lovely
you-
titrating up with
Yeah, so if you have
tretinoin.
it mixed with a low dose steroid, that makes it more easy to tolerate. And not everyone should be going up the dose. Everyone's obsessed with, can I go up with strength? Can I go up with strength? But actually, you're better being consistent and using it 3 to 4 times a week on the lower dose than moving up and only being able to use it.
That was what I
Twice
was
a
doing,
week.
and still, but I have found a
You
really
getting
good.
greedy?
Yeah, but I do find the retinol has the same effect with me because I am so sensitive. So maybe soon I'll be able to titrate it up a wee bit and get the tret.
I love mine mixed also with
With a hydroquinone.
yeah,
Yeah.
to dampen down I'm definitely prone to hyperpigmentation, so I love it with that, and that gives it that flawless.
Yeah, I mean, we did that together, and my skin was absolutely flawless. So maybe, Tara, that's something we can explore with
Yeah.
you.
Yeah.
Do
Although
you-
what I would say is I'm very keen to find out more about adding estrogen topically.
Yep.
yeah, I read a paper on that recently, but we'll just watch this space
Watch
because
this
it's
space.
yeah. Do you want to explain what tretinoin actually is, Tanya? I mean, you see so many TikToks, and like you said, the race to get to the higher amount.
Okay.
There's no need for that.
So what I'll do is I'll explain it how I would explain it to my
A patient, yeah, absolutely.
So you said retinol, and I said tretinoin. So retinol is the weak diluting orange juice in a glass, and the tretinoin is your Fanta or your Club Orange. So if you're wanting a real orangey drink and you're getting a weak diluting juice, that's going to be your retinol. It's not as effective. So what happens is the retinol needs to be converted into retinoic acid. Retinoic acid is what does the job. That's tretinoin in its straight form. But retinol has to be converted, and by the time it's converted, and it's such a small dose because it's non-prescription, by the time it's converted, the small amount that's left that's actually having an effect on your skin, it's not going to do very much.
No.
You know, when you're younger, you might notice something, but as you're getting a bit older, it's not really going to have the desired effect. So that you really need to be thinking about tretinoin.
Yeah, I would agree. I definitely would. And I think it's good to dip your toe in and start with your retinols, but then it's time to move up to the big game then.
Trying to say I'm getting old,
You're all
Emma.
right, you're all right.
Here, people in glass houses shouldn't throw stones, so I'm saying nothing at all. So what was the best piece of advice you've ever received in your aesthetic career?
I have two, but probably the one that has done me best was to master, and I use that word very lightly, one thing before you move on to learn about another. And my first year I did nothing but lips and toxin until I knew that I was comfortable doing those, not master them, because I still haven't mastered them. I don't think any of us have, you know, we're good at them.
We're always learning.
But there's always something new to learn. So for me, it wasn't until I was like, right, I'm confident enough now and I can kind of do things a bit differently and I'm ready for something else. You see a lot of people now doing a 1 or 2 day course where they're doing 10 different things. How can you do that? You know,
safe.
It's not safe at all.
So that's the best bit of advice I was ever getting. Master something and then move on to something else.
I like that.
That's lovely. I like that as well. What about yourself, Tanya?
Well, yours is quite constructive. Mine is get on Instagram. It was the best piece of advice at a very early stage from a lovely nurse who took me under her wing, brought me down to her clinic for the day.
Oh,
and
thank
said,
you.
There you go. It's
Get on the socials.
I love it.
That's a long time ago, isn't it?
Not that long.
Well, sure. You know, you do.
I'm forever grateful.
Well, you're very welcome. I'm sure you've passed that on. You did that for Tara as
Absolutely.
well. So.
Only I wasn't as gentle.
No.
I got digs in the ribs and shoved.
Well,
You did it.
We did it. We got there.
I'm very proud of you. So, listen, one word. What do you love most about working in aesthetics? One word, Tara. That's all you're allowed to say. One word.
Satisfaction.
Okay, lovely.
People.
Oh, lovely. Mine's confidence, building their confidence.
Yeah.
So let's have a bit of fun. If you wanted one trend in aesthetics to disappear, what would it be?
Oh, this is an easy one. A very easy one for me. Butterfly lips.
Oh, yeah. Yeah. Good one.
Dissolving lips in one day and having them refilled.
That would be mine actually as well. The lip taping. What?
Oh, whenever you understand how the products actually work, it's not possible, you know. And you're seeing them taped up, but has anybody seen them a couple of weeks later? What do they look like? You know, for me, that's the one I would like to disappear.
What Tara's talking about there is dissolving your lips and getting them filled in the same day. And you see people all taped up. That's what she's talking about when she says butterfly lips. I think that was actually one on my list as well. And yourself, Tanya?
Jawline filler. You know, when used appropriately and talked about and the pictures are showing subtle differences and there's no changes, no trickery with the lighting, filters, things like that. It's done great. But this snatched jawline, fakery, lying, it needs to go because it's not fair. It's making our youth or even older women feel like they are not beautiful because they don't have a snatched jawline. Yeah. I remember in COVID times patients coming in to me and saying, oh, you know, I'd really like jawline filler. And I would go, okay. If you tell me on your way in here today, at least one person that you looked at and said, oh, I really like their jawline. Because we don't do it. We don't look at people's jawlines. We look at people's eyes. Yeah. You know, that's what we're looking at.
Another thing I have to say there as well, the patient will say to you, when I do this, but how often do you walk about like that? Nobody walks about like this, you know, and then they'll maybe get a picture of a Kardashian out and be like, but look, they always look so snatched. But I'm like, go on to Google and write candid photos off and the person's name and you will see it's normal. We have to have movement. We have to be able to, you know, move our neck. So we need to have a wee bit of leeway here in order to do that. And in most of the photographs, the necks are elongated, the heads are lifted, you know, and that's where you're seeing that snatched jawline.
They're filtered.
Well,
that's what I say
too.
to everybody. If you had one of the Kardashians sitting in this room with us right now, they don't even look like themselves.
No.
Yeah.
They don't look like that.
Yeah, but coming on to filters, it's really unfair, especially on the younger.
It's one of the worst inventions ever made. I do not use filters. That's not to say I don't like a nice ring light.
Yes.
But I do not use filters, and I have it drummed into my daughter, who's 17 now, that if she goes down that route, it's very dangerous. And thankfully, she's not big into using filters. But it just makes people feel like unless they're looking that way, that they're not good enough. Yeah. Like I posted on my story yesterday, I was out with the little man in Hubby for a bite to eat, and I didn't have any makeup on. And I thought, do you know what? I'm going to post anyway.
Yeah.
And it wasn't the most flattering, but I don't really care.
No.
I have to get okay with not looking perfect.
Yeah.
Not that I ever did. But you know, whenever we use filters that are designed to make us look that little bit more flawless, I don't want to go down that way where I'm posting a picture of myself and I'm hating myself. But that's how I look.
Yeah.
And I have to be okay with that.
Well,
I can look better with makeup and a bit of put a few curls in the hair. But I don't want to ever get to the place where if I don't have my hair done or my makeup done, I'm not feeling good about myself or I'm not good enough.
Well, I did the same last night. I had to do a Zoom with Dermapen, and I thought, oh God, I'm not putting makeup on. It's Sunday, and I had my hair scraped back, no makeup on, and I thought, do I apologise or not? And actually the lady came on and said, I'm just out of the shower. I said, well, this is how I look on a Sunday, and it was so refreshing that both of us, two really strong women, just didn't care that we had no makeup on.
Well, I have to say, when I was over in MCAS, I had so many messages. Wow, you look amazing. You look fantastic. What have you had done? And I was like, I've curled my hair and put a bit of makeup on. Because if you walk into my clinic, I have nothing on my face. My hair's scraped back in a bun, so people thought it had work done because I had makeup on.
But I like that, because I think if we're coming in looking dolled up to the nines every day for our patients, then if it's maybe some days it's nice to go in to let them know that you care about your appearance,
Yeah.
and so that you'll care about theirs.
Well, I had no makeup on Thursday, and my patients were like, but I had done a microneedling treatment the day before, so I had no makeup on,
glowing.
and it was kind of like, your skin's beautiful, and I thought, so's yours. But I'm asking my patients to come in without makeup for their appointments. I thought, this is fair, safe environment. That's my thought.
It's 20 minutes saved in the morning. That's the way I look at it.
You're good if it's 20 minutes. So my last one is, if you could only ever have one aesthetic treatment ever again for the rest of your life, what would it be? We'll go to Tanya first this time.
If I could only have one non-surgical aesthetic treatment.
Non-surgical.
Stop you trying to
get on the surgical bed.
Toxin. Because you can always have surgery for the lack of volume and sagging, but nothing can replace what toxin does in terms of preventing your lines and wrinkles.
Yeah, that's actually the one of my toxins for me.
It's me too.
Yeah.
As someone who gets toxin from here to here very regularly, I couldn't be without it. I could happily leave fillers and stuff until I really, really needed them, but my toxin makes me feel fresher.
Excellent. Well, thank you very much, ladies.
Thanks
for having us.
Have you any questions for me? Because I've thrown loads at you.
Oh, here, don't start me.
Yeah, can I go get my coat on? It's freezing in here.
We'll just do a wind up now. Okay. What did I say? So that is a wrap for episode 4. I really want to thank these two amazing ladies for their honesty in this conversation. So lower face rejuvenation, I think it's a really interesting topic. I think it's do your homework and make sure you're the right patient for the right treatment. And if you want to know where these two ladies are, you can get Tara in Belfast and in Derry in Elite Aesthetics, and Tanya Khan Aesthetics as well. So thank you very much, ladies.
Thank you.
Emma.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.